Okay, good afternoon, and thank you for joining the daily briefing on the City of Philadelphia's response to COVID-19. Our speakers are joining the briefing virtually to adhere to social distancing guidelines. And we will begin our briefing with opening remarks from Mayor Jim Kenney. Mayor, you have the floor.
Thanks, Mike. Good afternoon, everyone. Today, I want to give a big shout out to the group Step Up to the Plate, which is a central part of the city's efforts to address housing and food insecurity. This group today marked 100,000 meals served to Philadelphians who are struggling with homelessness and poverty. Step Up to the Plate is a collaboration among the city, Broad Street Ministry, Project Home, Prevention Point Philadelphia, and CMAC. This all came together in a mere 2 weeks when the pandemic first hit Philadelphia. The partners raised $2 million to create 3 food service sites, plus additional food drop-offs at other community sites. The sites began during the week of April 13th and originally planned to operate for 7 weeks. Later today, the Step Up to the Plate partners will announce an extension of the program through August. So congratulations to all those involved. To get involved with Step Up to the Plate, visit stepupphilly.givesmart.com. That's stepupphilly.givesmart.com. As the virus has put an unbelievable strain on our social service providers, Step Up to the Plate is truly a shining example of how we can all come together to help those in need. I also want to give a quick shout out to a group of our favorite restaurateurs here in Philly, led by Rob Wasserman. They have come together to launch We Are Philly. The group is selling We Are Philly t-shirts. And I have one right here, if you can see it. For every t-shirt sold, a box of fresh produce from Giordano's is donated to a Philadelphian in need. In just 1 week, they've sold 1,900 t-shirts, resulting in 1,900 boxes of fresh produce for Philadelphians in need. You can learn more at bit.ly/We Are Philly. That's bit.ly/We Are Philly. Finally, I want to note that our policy office, in conjunction with the University of Pennsylvania, today released results of a resident survey on various aspects of life in Philadelphia during the pandemic. The online survey of 626 adult Philadelphia residents was conducted in early May. The results were weighted by age, race, gender, and education to be representative of the population of adults in Philadelphia. Among the findings were 3 out of 4 Philadelphians agree that everyone in Philadelphia needs to wear a mask every time they leave the house. Thank God there's so many smart people out there. And 3 out of 4 Philadelphians believe that it's important to stay at home, minimize social contact with others, and keep at least 6 feet away from others. We know African-American communities in Philadelphia are more likely to experience negative impacts of COVID-19. In this survey, Black Philadelphians were even more likely to believe in the importance of public health precautions. 86% of Black residents surveyed believe that it is important to stay at home, minimize social contact with others, and keep at least 6 feet away from others. So based on all this, it is clear that the vast majority of Philadelphians do get it. They understand the need to follow guidelines for social distancing. And if you're the 1 out of 4 who doesn't get it, your neighbors know how important this is to keep their families and friends safe. And we need you to get with the program. If we are to emerge from this shutdown as quickly as possible, we need as many people as possible to do what is right and follow these common sense precautions. It's not that hard. And now Dr. Farley has today's update.
Thank you very much, Mayor. We're continuing to see progress against the epidemic here in Philadelphia. Since this time yesterday, we've confirmed 237 new cases of the coronavirus infection, bringing us to a total of 21,975 since the beginning of the epidemic. Now, that 237 number for a single day is not a number I'm quite as happy about. I'd like to see lower, but overall the trend is still down. We're continuing to see progress in our congregate settings. We're seeing fewer outbreaks and control of the outbreaks that we've been dealing with. 0 new symptomatic cases in the jail since this time yesterday. The screening of asymptomatic inmates is ongoing, and we'll report later when we have the results of all that screening. In the city's hospitals, there are, as of yesterday afternoon, 432 inpatients with the coronavirus infection in Philadelphia. And in the Southeast Pennsylvania region, it's 886. Those numbers are slightly down from where we were yesterday. On deaths, we have confirmed 5 new deaths since this time yesterday. It's nice to be in the single digits, bringing us to a total of 1,248, of which 663 or 53% were in nursing home residents. Testing, just to remind people that yesterday we opened up our criteria for testing further. So now we're encouraging anyone at any age to go in and get a test. If you have any respiratory symptoms, like a cough or shortness of breath or sore throat or a fever, or even if you don't have symptoms and that you've been exposed or believe you've been exposed to someone with the coronavirus infection, and it's been 7 days, enough time for your test to turn positive. If you think you've had an exposure, you go to up to 50 sites across the city where you can get tested. Go to www.phila.gov/testing to see the map there, and you get all the phone numbers and where you need to call ahead to go ahead and get your test. We're still under a stay-at-home order, but as I said yesterday, we're getting closer to a stepwise, gradual restart. Remind people that effective yesterday, we said restaurants can allow on-site ordering of food. So people can walk up to a restaurant and order, but there are restrictions for that. People cannot dine in the restaurant. No lines of more than 10 people. We are encouraging the restaurants to encourage customers to wait outside for their meals so that we don't have clustering of people, and that they enforce the idea that everybody's wearing masks, staff as well as customers. If things continue to look good, we expect that Philadelphia will go to what the governor calls the yellow phase as of June 5th, and we hope to provide a plan and guidance on that before the week is out. That plan will involve many differences. Businesses will be asked to reduce the number of people in the store. There'll be barriers like those plexiglass barriers next to cash registers, asking for spacing of customers. And we're going to be asking businesses to enforce use of masks. If you've ever been to a beach town, you see a sign that say no shirt, no shoes, no service. It's going to be no mask, no service. We don't want you in the store unless you're wearing a mask. And if you're going to have to wear a mask when you go to a store, you might as well wear it when you're going anywhere else. This is something which we have to have it be as a new normal. That's the way we restart our economy and get people back to work, deal with some of our issues of unemployment without having the virus get more transmission. For more information, www.phila.gov/COVID is where all of our statistics are. If you have medical questions, 1-800-722-7112. Thanks.
Thank you, Dr. Farley. Now let's shift over to Armando for the Spanish language translation of the mayor's and Dr. Farley's comments.
Mensaje del alcalde Jim Kenney para el miércoles 27 de mayo del 2020. Buenas tardes a todos. Hoy quiero dar un gran saludo al grupo Step Up to the Plate, que es una parte clave de los esfuerzos de la ciudad para abordar el problema de la inseguridad alimentaria y la falta de vivienda. Este grupo hoy alcanzó su meta de servir 100,000 comidas a los habitantes de Filadelfia. Step Up to the Plate es una colaboración entre la ciudad, Broad Street Ministry, Project Home, Prevention Point Philadelphia y CMAC. Y todo esto ocurrió tan solo 2 semanas después de que la pandemia llegara a nuestra ciudad. Los aliados recaudaron $2 millones para crear 3 sitios principales para la entrega de alimentos, además de establecer otros puntos de distribución en sitios estratégicos de la ciudad. Los centros comenzaron a entregar alimentos durante la semana del 13 de abril y originalmente tenían planeado operar durante 7 semanas. Sin embargo, hoy, en horas de la tarde, nuestros amigos de Step Up to the Plate anunciarán una extensión del programa hasta agosto. Muchísimas gracias a todos ellos. Para obtener mayor información sobre Step Up to the Plate, visite su página web en stepupphilly.givesmart.com. Mientras que el virus ha puesto gran presión en quienes nos brindan servicios sociales, Step Up to the Plate es un brillante ejemplo de cómo, unidos, podemos ayudar a los más necesitados. También quiero saludar a un grupo de propietarios de restaurantes dirigido por Rob Wasserman, que se han unido para lanzar We Are Philly. El grupo está vendiendo camisetas con el mensaje We Are Philly. Por cada camiseta vendida se donará una caja de productos frescos de Giordano's a un residente de Filadelfia que así lo necesite. En solo una semana vendieron 1,900 camisetas, lo que resultó en 1,900 cajas de productos frescos para los residentes de Filadelfia que más lo necesitaban. Puede obtener mayor información en bit.ly/wearephilly.com. Finalmente, quiero señalar que nuestra Oficina de Políticas Públicas, junto con la Universidad de Pensilvania, publicaron hoy los resultados de una encuesta sobre la vida en Filadelfia durante la pandemia. La encuesta se efectuó en línea a principios de mayo con 626 residentes adultos de Filadelfia. Los resultados fueron ponderados por edad, raza, género y educación para que fueran representativos de la población adulta de Filadelfia. Entre sus hallazgos podemos mencionar que 3 de 4 habitantes de Filadelfia están de acuerdo con que todos en la ciudad deben usar una máscara o cubierta facial cada vez que salen de la casa. Y 3 de cada 4 habitantes de Filadelfia creen que es importante quedarse en casa y minimizar el contacto social con los demás, además de mantenerse a menos de 6 pies de distancia de todos los demás. Sabemos que las comunidades afroamericanas tienen más probabilidades de experimentar los impactos negativos del COVID-19. Los resultados de esta encuesta reflejaron que las comunidades afroamericanas de Filadelfia creen en la importancia de que las precauciones en la salud pública aún más que otras comunidades. El 86% de los afroamericanos encuestados creen que es importante quedarse en casa, minimizar el contacto social y mantenerse al menos a 6 pies de distancia de los demás. Entonces, en base a todo esto, nos queda claro que la gran mayoría de los habitantes de Filadelfia entienden la necesidad de seguir las pautas de distanciamiento social. Y si usted es una de las personas que no lo comprende, sus vecinos sí saben lo importante que es mantener a salvo a sus familias y a sus amigos. Por lo tanto, necesitamos que usted participe del programa y cumpla con estas normas. Si queremos volver a la normalidad lo más rápido posible, necesitamos que la mayor cantidad de gente haga lo correcto y cumpla con esta normativa, que por otro lado no es otra cosa más que obrar con sentido común. Y esta es la actualización en materia de salud para el miércoles 27 de mayo del 2020. Desde ayer se han confirmado 237 nuevos casos del coronavirus en Filadelfia. Actualmente tenemos un total de 21.975 casos en la ciudad y la tendencia es clara. Hay una disminución en el número de los casos. También hay avances en la evolución de los casos en los entornos grupales. No tenemos nuevos casos del COVID-19 en las cárceles y actualmente reportamos 2 casos confirmados. Los hogares de ancianos se encuentran ya realizando pruebas en pacientes asintomáticos. Sin embargo, se espera que se reporten más casos debido a que se están haciendo más pruebas. Hoy, tristemente, reportamos 5 muertes por el COVID-19 en la ciudad. Un total de 1.248 personas han muerto por el COVID-19. 663 o el 53% de estas muertes han sido en hogares de ancianos. Hay que recordar de que este virus no discrimina por raza o por género. Informamos que hasta ayer por la tarde, 432 personas han sido hospitalizadas en Filadelfia y 886 personas en la región sureste de Pensilvania. Las pruebas ahora están disponibles en casi 50 centros ubicados a lo largo y ancho de la ciudad. Usted puede ubicar el centro más cercano a su domicilio en fila.gov/testing. Les recordamos que las pruebas están disponibles con cita previa y alentamos a todas las personas de cualquier edad que tengan fiebre o problemas respiratorios a realizarse la prueba del COVID-19. Si usted ha estado en contacto con un caso confirmado o sospechoso del COVID-19, le exhortamos a realizarse esta prueba. Estamos ya muy cerca de la reapertura de nuestra ciudad. Y gradualmente se están levantando las restricciones establecidas en la orden de permanencia en casa, pero recordamos que la orden aún continúa vigente. Ahora se permite ordenar nuevamente comida para llevar directamente en los restaurantes, aunque todavía sigue suspendido el servicio de cena. Asimismo, no se permiten las colas de más de 10 personas dentro de los comercios. Se recomienda esperar fuera del local para recoger su orden. Pasaremos a la fase amarilla el 5 de junio si los números continúan siendo favorables. El plan y la normativa de reapertura se anunciará más tarde esta semana. El retorno a la normalidad significa que habrá muchos cambios para la actividad comercial. Hay que reducir el número de personas dentro de los establecimientos. Hay que acostumbrarnos a respetar las barreras de plexiglas en las cajas de los supermercados y en espacios donde se atienda a una gran cantidad de personas. Hay que seguir manteniendo y respetando la distancia social. Debemos normalizar también el uso de la máscara o cubierta facial al salir de la casa. Mi máscara te protege a ti, tu máscara me protege a mí. Así que hay que usarla, porque solo juntos podremos superar este gran reto. Muchas gracias.
Great. Thank you, Armando. And now we're going to move to the Q&A portion for members of the media. Remember, of course, we have limited time during the briefing, so only one representative from each media outlet is permitted to ask questions during the first round. Reporters are asked to limit their questions to 3 or fewer. We will do a second round of questions if time permits. So if you are logged in today, please use the raise your hand feature found under the participants list. And we ask that you activate your video to ask your question when you are called on, and we will now unmute the reporters one by one to ask their questions, starting with Mitch Blocker of NBC 10.
Good afternoon. I have a few questions for the mayor. In the last 24 hours, there's been a string of shootings in Philadelphia. I'm curious how the pandemic has affected police's ability to solve crime.
I don't think the pandemic is the root of the problem. I mean, as you saw last night with that poor little boy, that was inside the house with a gun that was unsecured. I don't know the details of with the shooting, how the shooting happened, but the police are investigating. I think there's just too many damn guns in our society and in the hands of people who don't use them properly and don't secure them properly. I don't believe, our homicide clearance rate is higher than it's been. Certainly the shootings are more than we'd like. And the homicide rate is about 12 to 14% higher than it was this time last year. There's too much violence and there's too many guns. I mean, if I look at countries like Canada, where people can't get their hands on guns, they have as much death, homicides nationwide as we do in the city of Philadelphia in a year. So as long as we have guns in our society and they're available easier than a library card or a driver's license, we're going to have violence. But I don't think it's affected directly. I mean, obviously the police have to take certain precautions when it comes to masking and doing things that they have to keep themselves safe. But I think we were in a violent society and a very poor city, and people utilize weaponry to take out their frustrations and or their grudges or beefs with people, and we're doing our best to get our arms around that. But as long as we have the proliferation of weaponry that we have in this country, you're going to have this kind of problem.
While homicides are up in Philadelphia right now, most violent crime is down according to police statistics.
Right.
Why do you think that is?
More people are shooting each other. I mean, I don't have the holistic answer to how you stop homicides in the country other than getting guns out of people's hands, which we've been trying to do now for a number of years. But as soon as we increase the number of weapons that we confiscate, more weapons flow into the city, and we could use help from the federal government. The U.S. Justice Department could be helpful in trying to reduce the number of guns that flow into cities around our country.
But the violent crime overall is down. You're talking about rapes, assaults; those types of crimes are actually diminished in 2020. Does the pandemic have anything to do with that? I
think there may be less reporting going on too. Also, I think that the issue of domestic violence is always and child abuse is also always an issue when it comes to people being forced to stay home. I'm glad to see the violent crime is down, and we're continuing to work on our shootings and homicides. But I will tell you, as long as guns are unfettered in our society, we're going to have high homicide and shooting rates.
Any consideration of a policy change in Philadelphia regarding guns?
We're not able to do that because the state controls the gun laws, and we have a president that loves the Second Amendment very much.
All right. Thank you,
Thank you, sir.
Thanks, Mitch. Now we go to Howard Monroe of CBS 3.
Good afternoon, Mayor. Going on that same line, is there any concern now that it's warmer out? People tend to be congregating in places. Is there any concern that this violent trend will continue going through the warmer months?
There's a concern on my part every single day about any type of increase of violence. Yes, in warmer weather, things tend to get a little more out of control, but we are trying to locate our officers in places where we believe we can intercede before the violence actually starts. But if you gave us the ability to take guns out of people's hands and not allow, one of the striking things about this pandemic was that essential business were gun stores. You tell me, as long as people have access to guns, we're going to have this kind of violence, and we're doing our best to assign our officers where we think the violence is going to happen. We follow social media and the other types of intelligence to make sure that we put our people in the right place. And we work every day to get the gun violence and the homicide rate down. It's not the highest it's been in the history of the city, but it's concerning nonetheless.
And also, Mayor, for you and probably for Brian as well, the city is in the process, its budget process now that had to be sort of changed around a bit. The state is also in a budget process. The House at least has approved a 5-month extension of last year's budget. How does that process of only giving a partial year budget, does that impact your process going forward?
Well, it's been a little bit helpful on this flats funding for schools. I guess under the 5-month program, the schools will be getting, our public schools will be getting as much as they received last year when we anticipated a cut. So on one hand, it may be helpful. On the other hand, we have to give them some time to breathe and figure out where they got to go going forward. And I think that at some point in time, they're going to have to raise revenue, even though they've avoided doing that for a number of years. Government can't run without revenue, and they're going to have to figure it out. And then we're going to have to adjust and pivot based on what they decide after 5 months.
Thank you.
Thank you, Howard. Now let's go to the Inquirer's Laura McChrystal.
Hi. Given the fact that we had more than 200 cases reported today, a question for Dr. Farley. As far as moving to the yellow phase on June 5th, do you think the city will reach by then its target of about 50 cases a day? And if not, what does that mean as far as contact tracing as we move into the next phase?
I don't think we're going to get down to 50 cases a day by June 5th, even if the numbers continue to look good, even if we start to see a decrease. I think that would be okay if we're continuing to see some decrease between now and then. I don't think we need to have everything in place for this first stage of yellow, which is really a very careful restarting of some activities, which are relatively low risk activities. But to the larger question, we do need to follow the numbers between now and then. If they get worse, then we could reconsider that. So it's not a guarantee that we'll be ready to go to yellow on June 5th. It's just if the numbers continue to look good.
Okay. And the survey that the mayor mentioned, were there more questions that were asked of that survey? And would it be possible to see the full survey and results?
I don't have the survey. I should have my notes for today, but I'm sure there's a document that exists.
Yeah, Laura, we'll be the press release going out shortly. Maybe it's already gone. I have some details, but we also, have a summary document, and we could also get you the raw data.
Okay. And one last question for the mayor. On the city budget, as other areas are cut or, some offices eliminated, all of the programs funded by the beverage tax are remaining intact. I know that some city council members have raised questions about that and whether some of that beverage tax money should be allocated elsewhere. And the controller put out something last week regarding, maintaining just the current funding for pre-K and community schools. Can you comment on keeping those programs in place?
That's what we're doing. We're maintaining last year's level of funding for pre-K and community schools. And we're moving forward at a bit slower pace on rebuild. But the money the tax was passed for the purpose of those 3 agenda items, and that's what I intend to do with them. I'm not going to end 4 and 5-year-old pre-K to pay for some other program. I mean, that's what the council voted on for the use of that money. That's what we've been using it for, and we'll continue to use it for those programs. And again, the proposed budget is a living document that can be changed if people want to change it. This is what we thought was the best and fairest and most balanced way to address this historic economic crisis and historic health crisis. I happen to be the mayor at this point in time. I know there are other people who want to be mayor or want to pretend to be mayor, and they can continue to do that. But right now I have the job, and this is what we think is the best thing.
Okay, thanks.
All right, thank you, Laura. And now we go to Pat Loeb of KYW.
Hi. Mayor, you talked about the city's inability to deal with guns, but there is a law on the book that requires the adults in a household with guns to be responsible for securing them. Right. Is there any enforcement of that law, especially in light of this 9-year-old's death?
I mean, I understand the laws on the books. I don't know how practically or operationally we would enter people's homes to determine whether or not their firearm was secure. I mean, the frustration with a lot of these homicides are about a third of these homicides are indoors. We can't place a police officer in somebody's living room. And if there's a complaint or disturbance, we can come and investigate. And if there's a gun that's loose and available or in the plain sight of a police officer, there's certain things we can do. But if we were starting to enter people's homes without warrant and with the attempt of securing guns and making sure they were secured, I'm sure we'd be in federal court by the afternoon.
Okay. And on a different subject, Mayor, City Council today kind of yelled at Dr. Farley about the perceived inequity in the city's response to COVID in terms of testing. Do you think the city's response to this pandemic has been equitable? Yes,
there's 50 sites available. We just opened one yesterday in North Philadelphia with Council President. With the site is in his district at an old police district building, and is now a health center building. We'll continue to expand opportunity for testing, and we'll continue to expand as we're building our testing and tracing, contact tracing, which will be the real way to address this situation. But let me say, I have never worked with a public official, a public servant, more dedicated than Tom Farley. The man works 16 hours a day. He's got the weight of the world on his shoulders. The decisions that he makes are literally life and death decisions, and he is responsible, in my view, for the salvation or the saving of tens of thousands of lives in the city. And if council wants to yell at him, he's a big boy. He can take it. But I have never worked with a public servant that is that dedicated to public health, that does it in a very calm and very thoughtful manner, who looks at data and makes decisions based on data, not on emotion or not on politics. I understand that council, you can yell at people if they want, but he certainly does not deserve it. And he certainly has been one of the best public servants I've ever worked with. So we'll continue moving on, saving people and doing the right thing.
Thank you. That's it.
All right. Thank you, Pat. And seeing no further questions, that concludes today's daily briefing. We will resume these tomorrow at 1 p.m.